Developmentally appropriate healthcare is about giving the young people a choice and a voice. It's about their decisions around their health and their needs and the provision that's provided, but also doing it a holistic approach that the parents and carers can support them, as well as obviously the professionals in making those choices. And it's about obviously making sure that we're, even if they don't agree to what we're saying, that we can explore that to give them an opportunity to make the right decision.
When we get developmentally appropriate healthcare right, it's an amazing feeling. It makes a huge difference to patients and their families. Patients feel invested in and they feel like they've been treated as an individual and not a number or an age. They also realise that adult services are there to treat them and their condition, and that actually we're not a service to be afraid of. It builds a huge amount of confidence in our services, and it makes them want to access services and not be afraid of us.
In terms of what hospital colleagues and other healthcare professionals can do differently, it's about championing young people. It's about understanding that they do have developmentally appropriate healthcare needs, that they are evolving and developing as a person. It's about having that compassion to understand that the person you see in front of you may be different tomorrow or the next 3 months, and adjusting your style and your way of delivering care to meet that changing young person and to watch them flourish.
Family and friends can help a young person who's going through transition by thinking about their developmental level. Specifically, if you're a family member who has always been heavily involved in their child's healthcare, you can take a step back. Be open, have open and honest discussions with your teenager about what they want. How do they want this to do? Do they want to go into appointments by themselves? Do they want to talk to doctors by themselves? Or would they like a half and half appointment where they talk to you and then you talk together? What support do they want from you? You need to understand that they need to grow. And hard as that is for us as clinicians and parents, it's really, really important that we help them to grow and not just tell them what's going to come.
It's very important that the care's the same all the way over South Yorkshire and Bassetlaw. We see time and time again when perhaps healthcare hasn't been delivered in a sort of developmentally appropriate manner, that young people and carers and families vote with their feet, and the place that can offer the best developmentally appropriate healthcare, often they ask to be referred to other centres where they feel their needs will be understood more, and we don't want to have a postcode lottery or an unequal system. We need all clinicians and anybody dealing in healthcare to understand developmentally appropriate healthcare so that we get the best outcomes for patients, families and carers